Okay, started your 2 minutes time. One more page.
Ma'am,
Start.
Hello, I'm Dr. Call, one of the doctors in the clinic today. Postnatal clinic today? Am I speaking to Mrs. Annie, 31 years old?
Yeah, I'm Annie.
Annie, apologies, as you were supposed to be seen by my consultant and he's not available. Is it okay if I continue?
Yeah, you can go ahead, doctor. No worries.
So, Annie, I've gone through your notes, the notes, and I can see that you delivered a couple of days back, and you had a difficult delivery. You had a difficult experience after your delivery, isn't it?
Yeah, it was pretty difficult.
Mm-hmm. So I'm here to address all your concerns. If you can you just tell me more about your concerns, which I need to address today?
Actually, I'm not having any concern. I'm just here just for this follow-up because
Mm-hmm.
they wanted me to see after a week.
Mm-hmm.
I am really upset, doctor, because I was having these complaints of breathlessness and I was having the uh, swollen legs, and they have not took me seriously.
Mm-hmm.
So I don't know why. That is the only concern I'm having.
Mm-hmm. I see. Surely I will be addressing this in a while, but before that, can I ask you a few more questions?
Oh yeah.
Okay. So can you tell me how is your recovery today? How are you feeling today?
Today I'm feeling better off.
Mm-hmm. Okay. Any breathing difficulties?
No.
Are you able to do your routine activities?
Uh, I cannot exert myself very bad, means very rigorously, but yes, I
Mm-hmm.
am able to do my minimal activities as with ease.
Okay. And all right. And what about any concerns with the bowel or bowel works or opening of your water works?
No,
Okay. Any swelling in the legs at the moment?
no, as of now, the swelling is not there.
Mm-hmm. Any raised blood pressures?
Mm, I
Mm-hmm.
think it is controlled.
Okay. And we will check that. And what about your babies? How are your babies?
My babies, twin babies, I'm
Mhm.
having, and both of them are been with my husband. He's just waiting
Mhm.
outside. Both are doing
Okay.
fine.
All right. Congratulations for becoming a mom. So,
Thank you.
okay. So, are you breastfeeding?
Uh, Actually, I'm finding it difficult, and that is one question again whether I do need to breastfeed them or not.
Mm-hmm. I see. Surely, I will be discussing that also. So, can you just tell me are you aware what happened to you after the delivery?
Uh, I don't know actually, but I just remember that after the delivery, suddenly I had lost my consciousness, and then there was chaos.
Mm-hmm.
And when I woke up, I was in high dependency unit where they were treating me with multiple drips. I don't
Mm-hmm.
know. After that,
Mm-hmm.
they had investigated and they said something like cardiomyopathy or something like that, but I have not been explained properly.
Surely, I will be explaining you. And I can see that you are on some blood thinners. Apart from that, are you on any other medication as well?
They had started me on some certain medications, and which I'm taking it quite regularly.
Do you remember the names?
No.
Okay, no worries. With your permission, I would like to see your records. Okay, and was this your first pregnancy?
Yes.
Did you do you are you aware that did you bleed a lot in the delivery?
I think so. There was some significant amount of bleeding because it was a twin pregnancy.
Mm-hmm. I see. And was it were you did you receive any blood?
Uh, Most probably I received.
Mm-hmm. Okay, I will be checking your records in a while. Okay, and any known allergies?
No,
Okay, and I can see that your weight to height ratio is 37. Ma'am, can you change? You're 27.
yeah,
Am I right?
yeah,
Mm-hmm. Okay, and do you smoke?
no,
Okay, and are you well supported at
yeah, I'm
home?
quite well supported.
Mm-hmm. Okay. Just to double check, you had twins. So was it a spontaneous pregnancy or it was with the help of a test tube?
It was actually with the help of test tube babies.
I see. Okay. All right. So can okay. So I do have your reports with me, Annie. The heart scan, some blood test, and the heart which were done at that time when you were admitted. So, do you want your partner to be with you before we discuss what's happening with you?
No, no, it's okay. You can go ahead.
All right. So, as per the GP referral letter, which I can see, you had a
These are my
condition.
case details. These are my case details, doctor.
Okay, okay. So I've sorry, apologies. So I've gone through your case details, and I can see that after confirming your name and identity, um, your heart scan showed that the heart's pumping capacity was less than the normal, which we called as which is generally 45%, but in your case it was quite low, that is 41. And this condition is, and your blood strength is 10, which is also low, might be because you bled a lot in the delivery. And your heart scan showed that the heartbeat was quite faster. So, seeing your history and these investigations, as you're already aware that you had a condition called as cardiomyopathy. Okay.
Yeah, I
So,
wanted to know what it is, doctor.
absolutely, I will be explaining you. Well, it is a condition which affects the heart. Annie, what generally happens is what happens, the pumping capacity, the heart enlarges and the pumping capacity of the heart reduces, and which results in such symptoms like shortness of breath, difficulty in breathing. The
Okay.
exact the exact reason we cannot say at the moment still, but there are some risk factors which can precipitate this. At times, it can be due to more than one baby, multiple deliveries. At times, if there is an high weight to height ratio, can also trigger this. High blood pressures can even cause this. Am I clear?
Okay. Okay.
Well,
But
it's
then,
a rare.
doctor, I'm really having a concern. Why they are not diagnosed this initially? Because I was continuously telling from 31 weeks, I'm having this difficulty in taking breaths. I'm having this swollen legs. I was constantly behind them, but they didn't took me seriously.
Mhm. Well, I am really sorry you're feeling that way. It's a very rare condition. It occurs in 1 in 1,000 pregnancies, Annie. And the symptoms which this condition has are quite similar to a normal pregnancy, like swelling in legs or difficulty in breathing can occur if a woman is pregnant with reduced blood strengths or
Okay.
maybe raised blood pressure. That can also cause this. So that is why
I'm
that
really
must be one
upset
of the
regarding that.
reasons.
I'm really upset regarding that. Okay,
Well,
doctor.
you,
Now what, doctor? What?
Mhm,
How it's going to affect me, my recovery, and my future
mhm.
pregnancy plan?
Well, regarding your, you are being seen by the group of healthcare professionals, which is including the consultant, the heart specialist, and also the counselors, the specialist nurse, midwife, and the GPs also kept in the loop. You have to be in a regular follow up with your specialist, the heart specialist, who will be doing your echoes, the heart scans to see how your pumping capacity of the heart is. Am I clear till now?
Okay.
Well, you are taking the heparin, the blood thinners, which you need to take it for at least 6 weeks, and you have to be very compliant with this medication.
Okay.
Okay.
Definitely, doctor. Yeah.
Regarding the blood of breastfeeding, if you can breastfeed your babies, but we need to check your medications. Are they breastfeeding safe? And if you are feeling better, then only it's advisable to breastfeed your babies. Else, if you're not feeling that you can, then it should be avoided. Am I clear?
Okay. Yeah. Okay, doctor.
Regarding any questions till now?
No, that is what I wanted to know. And how is going to means whether it is going to be the similar situation or I'm going to get it completely relieved of the
Um,
symptoms.
well, I
Um,
totally acknowledge. Annie, this condition is a very has a very good outcome, but yes, it has a recurrence rate as well. But if you plan a pregnancy for upcoming, if you want to have a babies, then it's advisable to have a pre-pregnancy counseling. There should be the group of healthcare professionals looking at you. Your heart scan should be absolutely fine before you go ahead with the pregnancy, as there is 1 in 5 chance that it might reoccur in your pregnancy if your heart is absolutely stable. Am I clear?
okay. Okay. Okay.
So there can be, and the condition can even worse. Okay.
Okay. Yeah.
So it's advisable for you to use an effective contraception for which we can connect you to the family planning clinic, keeping in mind not to use estrogen containing pills. We will be documenting everything in your notes as well. And
Okay.
in your next pregnancy, we will be starting you on blood thinners from the very beginning, and you will be booked in a consultant unit as well. If you go ahead with the pregnancy and everything is settled.
Okay, doctor.
However, Annie, if the pumping capacity, if your condition deteriorates, like your heart condition is the fraction is less than the expected, then it's advisable not to go ahead with the pregnancy, which we will be discussing you in the few next echo scans.
Okay. Okay.
Any questions?
No, doctor. Thank you.
Okay, here is the patient information leaflet on the this condition, cardiomyopathy, and you can read it. And still, if you have any concerns, you can let us know. I will be writing back to your GP as well and the community midwife who will be looking at your condition. Anytime if you feel shortness of breath or any difficulties, please report on this 24-hour emergency contact number. Thank you for speaking to me.
Thank you, doctor. Thank you for your time. Nice presentation. Okay. Your own reflection.
Ma'am, I'm confused about the breastfeeding. Some at time they say it's written if the ejection fraction is not
Very
stable, then
less than 35, I think. And then
yeah.
we should
Hmm.
discourage. But now you can very easily settle. Whatever you had told me, it's okay. Means if you are comfortable and ejection fraction improves, you can consider. Then there are those oxytocins and those also. They had a weird theory
Hmm.
regarding breastfeeding. Not only that, whether that will aggravate her cardiomyopathy, that is again there. So we will discuss this question also, okay, in the group. Let's see. um, okay, but uh, apart from that, that is googly for you. What do you think? Because that has been asked by the patient, huh?
Yes, ma'am.
Ma'am, I wanted to ask whether what we will advise her regarding the future pregnancies.
Yeah, we will discuss that, Aarti. We will discuss that. We will discuss in the answer key what we regard asked me. Whatever she has explained was actually correct. That she should go, means before planning, she should be totally recovered of this condition as of now. In the chances of recurrence is very high in the next pregnancy. So pre-pregnancy counseling is must for her. A baseline 2D echo at that time, and Depending upon that, she will be advised regarding that. The risk of recurrence is 50% and risk of life-threatening events in the future pregnancy is 20%. So we need to
Ma'am,
explain both the
it's
options.
written if the heart condition is stabilized, then there is recurrence of 20 in 100. And if she has persistent left ventricular
Yeah,
dysfunction,
yeah,
then it
yeah,
is.
yeah. Then it
Mm-hmm.
is 50%. Yes, yes, yes.
Mm-hmm.
And still, if it is the persistent changes, and then that in that 20%, in that 50, so that life-threatening events can also happen if there will be a recurrence, means persistence of symptoms.
Yeah.
So, okay, so
Ma'am.
that life-threatening, because sometimes it might ended up in failing heart.
Mm-hmm.
Hmm?
Mm-hmm. So,
One
ma'am,
thing.
what has ma'am, you were saying I'm very upset. I'm very upset. What should I say when you were
Okay.
upset?
I was upset because you have whatever you had identified that why you have not picked up my problems when I was telling you from 32 weeks that I'm having this swollen legs, I'm having that breathlessness. You didn't
Hmm.
investigate. You took me very lightly, doctor. You took me very lightly because I was constantly telling you. But what exactly you said is the answer, because the symptoms of peripartum cardiomyopathy and the symptoms of pregnancy between gestation are similar. They can mimic, and since this is not a common condition, the most common condition is twins with pregnancy, where you will definitely have the symptoms. So
Mm-hmm.
that's the reason the GP or the consultant couldn't took you seriously.
Mm-hmm.
Okay, because the symptoms mimic.
Ma'am,
Okay.
should we do the instant reporting?
Not now, dear. Now, see, she had collapsed. Whatever means incident reporting, she is just here for a follow-up plan. Max to max, if you wish that you wanted to know why we have not investigated at 31 weeks of time, we cannot say. Means now she has delivered at 35. So for that, I don't think that incident reporting will be an adequate thing. They just wanted to know this only, that the symptoms of heart, means cardiac failure and heart elements, are similar to the symptoms of pregnancy, and many a times because of their similarities, one might miss it. One might miss it.
Mm-hmm.
Okay.
Okay, ma'am.
Okay.
Mm-hmm.
Dr. Vajata, I want to ask one question. Like in the exam, one patient asked if you induce me early, so my symptoms get improved. So why you didn't provide me the induction? So how we will answer this question?
In the same this patient only or any other patient?
Yeah, the same patient, but the one question she asked that why you didn't induce me early so that my complications can be reduced. I didn't go through such type of the consequences which I went through.
Uh, so here actually the induction decision will always be taken by the consultant. One thing, we always weigh the risk and pros of inducing early. Uh, if if
Ma'am,
we
hmm,
we would have diagnosed you at that time with this
hmm,
condition, heart condition, then we might have induced you. But if it would not have had been a heart condition, then the risk of prematurity is very high with the babies.
hmm. Ma'am, even
Okay.
it can happen with the after the few months as well. So even if we induce, then it will not going to change any further
No
management
change.
as well.
It is not going to change the further management. But if at all we will identify, then at least okay, we can offer her induction. Still, it is
Yes,
better that
okay.
she should go. Yeah, she should go in spontaneous labor. It is still
Yeah, okay.
better, because that
Better,
induction will
okay.
also additional put a additional strain on her failing heart.
Hmm.
So that
Okay.
decision
Thank
will
you, ma'am.
not be, yeah, so this decision will be taken by MDT, including you, consultant obstetrician, and the neonatologist, anesthetist, whether it is
Hmm.
safe to induce you at that point. If it is a
Okay.
diagnosed heart condition, if it is an undiagnosed heart condition, and we wanted to prevent these symptoms, it is not ideal to induce, because most of the time
Risk
the
of premature.
pregnancy symptoms, yeah, pregnancy symptoms get relieved, and they're not life threatening, but the risk of prematurity is very high if we induce patients early. So that risk of prematurity, unless and until it is not indicated, we will not take it.
Okay. Thank you, ma'am. Yeah.
And when are the generally patients delivered at 37 weeks or
Here,
term?
yeah, so this is actually MDT. Peripartum cardiomyopathy, generally diagnosed pre-pregnancy, will be delivered by MDT. And the
Oh.
MDT will only decide whether we need to deliver her by induction or whether it is a C-section will be a safer option depending upon her heart and condition. So this is the most best part about RCOG or MRCOG part 3. We do not need to take a decision. We can just tell her that it will be depending upon the symptoms, how badly you will be affected, how badly your heart will be affected. The decision will be taken by team of consultant, including anesthetist, pediatrician, obstetrician, and you. And which
Mhm.
mode of delivery will be a better for you? Which mode of
Mhm.
delivery?
They play very safely, ma'am.
They play very
RCOG.
safely, and that's the reason we need to identify, because we are having a habit of telling no, 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 we cannot induce. Okay, we will induce. No, it is always a safe approach that you blame it on everyone, that they will be taking a consultation, they will be doing it. It will not be you who will be taking it.
Mhm. Okay,
Okay.
ma'am.
Yeah. So induction, if at all, it's always, if it is indicated, definitely you are going to go ahead. If not indicated, risk and pros of induction, and that risk of induction on this failing heart is very important.
Mhm.
Mm, everything you had means coming to my feedback, Shweta, you had completed maximum answer means points in my answer key. What I wanted to one question, okay, a similar complaints. What had happened to you? One question which I gave it in means, although you had asked me a different question, but I told you what exactly had happened to me. Whether the similar episode had happened to you previously, because I was only telling you, yes, this has happened to me, this has happened to me. So that might be a
Mhm.
information gathering.
Mhm.
Okay,
Okay,
any
ma'am.
similar episode which has happened? Okay, so have you noticed any breathing difficulties? Have you noticed any? So this kind of.
Okay, ma'am.
So this can be asked actually whether it is needed or something like that. So that similar episode of similar complaints, that breathlessness with edema, uh, so that can be asked. Uh, then NYHA you had asked me, and the rest of the points were very clear. Uh, Risk factor you had mentioned. Breastfeeding also we had discussed. Why it is 45 degree? I do 45%. The normal ejection fraction is 60%. Up to 60% we are taking it normal, na?
Hmm. Ma'am, I got confused. It's more than 45.
Yeah, it is up to
Yes, ma'am.
60%.
Ma'am,
Hmm.
it's less than 45 is PPCM, no, ma'am?
Yeah, less than 45 it is PPCM,
The
but
normal
up
is
to
50 to 60.
60%.
Yeah.
Up to 60%.
Yeah.
55.
55 to 60%. 55 to
55.
60.
Mhm.
Yeah, 55 to 60%. That is right. Then explaining, when you wanted to explain what is PPCM, please take a help of diagram.
Mhm.
Draw, I had
Yes.
mentioned there. Yeah, draw, I have mentioned there. Then cabergoline also, no? They give sometimes cabergoline. I do not know what is the significance of cabergoline, but if they ask certain questions, so you can very easily say that as of now, the peripartum cardiomyopathy is being treated symptomatically. We all know that.
Mhm.
Okay.
Yeah.
So symptomatic treatment, basically to pump more and more blood to minimize her blood pressure, and low molecular weight heparin to prevent the risk of blood clot formation. Okay,
Mhm.
so if it is there is any other question, then you can just tell her that so far as my knowledge, according to my knowledge as of now, they had been treated with the help of symptomatic treatment. If there are any newer modalities, I will definitely put you in touch with the cardiologist and take his opinion regarding the same, but symptomatic
Mhm.
treatment, okay, as of now.
Okay. Mhm.
Sinus tachycardia, everything. Now, what we will just go through the answer key, introduction and situational awareness. Concern, the same concern. One is breastfeeding, another one is why you have not investigated me at that time. Okay, setting agenda, red flags, NYHA. So, what NYHA classification that will trigger your management plan. If I say no, I'm getting breathlessness, I'm at ease, I'm not at ease, I am breathless at uh, this point also while talking to you, then it will be admit and then escalation of care. Okay, so that is maternal medicine. If there is any red flag which is present, admit and escalation of care. As of now, whatever she is having, continue. Most chances she will come out of this condition, as you rightly said, that is, she is having a very good prognosis. Can you take me through the events is my question, because I wanted to know what had happened to you. Did someone debriefed you? Details of this pregnancy, whatever. How is baby doing? Breastfeeding, what was the next question. Then the retrospective history, that is bladder, bowel, and bleeding also you can ask. Any similar history in the past or in the family? Okay, that is one question what I wanted. Smoking is only important here. Support you can ask because she is a post delivery with this kind of difficulties, and that is showing because mostly lay exams task, mostly lay exam task. Anything to add? If it is there, you can just now.
So
What is
Rajata, should
PP?
we ask here like any plans for contraception or not? Later on we will ask.
See, you are going to say, tell her that till the time you are not going to get covered, you can ask her because she's just 7 days, dear.
Yeah, she's just 7 days. Yeah.
7 days. Shh. She's just 7 days, so that contraception will come when it will be at least 4 weeks.
21 days.
Yeah, at
Mm.
least 4 weeks. Okay, so at that time you can really means you can discuss the contraception. But as of now, that's the reason I have not included it in my answer key. Also, it looks very weird. Okay, have you resumed sex or something like that? Also, it is difficult to ask. And what means are you
Mm-hmm.
using any contraception? That's the reason I have not included those questions because that will again increase our
Time
time,
we are
and
so it's
yeah,
not
it will be
necessary here.
yeah, it's
Okay.
not going to but you are going to offer this patient the contraception when we are going to say that do not conceive till your heart's
Okay, ma'am.
relieved of these symptoms completely, then avoid COC, the rightly said by Shweta.
Ma'am, should we say estrogen containing pills or should we say directly combine or combine oral contraceptives? Or
Both, anything.
anything we can. Okay.
Just दार लावून घे. Okay. So now coming to our answer key. Now this part I wanted you in detail, dear. Okay, what is postpartum cardiomyopathy? Checking my knowledge because I already told me. Yeah, they were saying something, but I don't know what is that, doctor. Okay. Mm, so what is PPCM? You have to explain that rare type of heart muscle disease which you had mentioned. When it occurs, okay, especially occurs when it is in the last few months, last part of the pregnancy or the initial few months of the after the delivery. The pumping action is weakened. And why it is weakened, we do not know. And the left side of the heart, this we have to explain there. Left side of the heart, what is the function of that left? So PPCM, explaining PPCM in a proper way, that was missing Shweta in your so
Mm-hmm.
that is
Okay.
actually debriefing about PPCM. What is PPCM? So the right and the left chamber in this condition, the left side is dilated or enlarged, thinning of that chamber does, and the weakness of the heart muscle, which gives rise to poor pumping action of the left side of heart. Uh, in Because of this problem, because of this changes, there will be less oxygenated blood supply to the other organs and accumulation of fluid in our lungs, which will give to breathlessness, edema feet, and sometimes even a collapse. Yes. So this I
Yes.
wanted. Yeah, so this I wanted to listen from you. What is PPCM in exactly within a very short time? So here you can take a diagram, help of a diagram. Affects main pumping chamber, that is left chamber of the heart. Normally the left ventricle pumps blood out of the heart efficiently with enough pressure to reach all areas of body. In PPCM, the left ventricle chamber becomes enlarged, muscles weaker, and their vascular wall gets stretched and thinner. Difficult to pump blood and start getting accumulated in the lungs. Okay, so backflow, basically the backflow changes on the back changes on your lungs, and because of that less oxygen gets to the body organ, causing symptoms of breathlessness, coughing, and edema fit. In extreme fatigue, this is referred as heart failure. Okay, so this is something which is known as heart failure. And heart failing is as the heart is failing to meet the body's normal demands of oxygen. So basically, it is something which is heart failure. And now, see, ejection fraction. What is ejection fraction? In simple word, you can explain what is that is a measures the amount of blood that is pumped out of from the heart with each contraction. So ejection fraction is the measurement of amount of blood pumped out of heart with each contraction. It is normally 55 to 60%. In your case, it is less. And it measures the pumping action of your or the function of your left side. Hmm? So your that is a measure to it is a parameter to measure your function of the left ventricle or the left heart. A risk factor, yes, age, multipara, twin gestation, pre-existing heart condition, overweight, and PPH. Okay, these are the risk factor. So there are we do not know, very rightly you have said, because we do not know the exact cause why this has happened, but there are certain risk factor associated with this. Management, yes, MDT, frequent echo, because we are going to follow her up with frequent echo. Continue your medication which you had mentioned. Red flags to be reported immediately. Okay, for that I will be giving you contact details. So you had mentioned all those points. Prognosis, the course illness is unpredictable, but 6 to 8 out of 10 women will recover completely by 6 weeks post-delivery. This is the sentence what I wanted to listen to you. So most of the time there will be a complete recovery, but as of now, I will be referring to a cardiologist to assess your heart health and review your medication. Future risk of recurrence is there, so need to take a pre-pregnancy advice before embarking it. Risk of recurrence is 50% having this condition, and risk of life-threatening events I had mentioned 20%. I don't know why I had mentioned. We need to check again. So why we did not pay attention at 31 weeks of gestation? The symptoms of PPCM mimicking common symptoms of pregnancy, and since we were carrying twin pregnancies, we thought of it as a most common symptoms, and that's the reason we neglect those symptoms at that time. And we are really sorry that we didn't took you seriously. So I will suggest use effective contraception to avoid pregnancy, avoid COC or hormones. Incident reporting, root cause analysis. Root cause analysis, I don't think it is needed basically, but okay, collapse patient. You can just say this way, that if at all there will be any investigation, we will come up. If the investigation will be started by the department, then we will definitely come up with the report. We will definitely come up with the report, and we will discuss and debrief you whenever my consultant will be available next time. Okay, and close the loop. Okay, so close the loop. So very nicely done. But that PPCM, what is PPCM and what is ejection fraction? They wanted to listen here. See,
Okay, ma'am.
I was not being debriefed. So proper PPCM, proper ejection fraction.
Okay, ma'am.
Oh. Okay, so
Ma'am.
done. The next case.
Dr. Parjata, is there need to ask any family history of cardiac problems? Like we can avoid
Yeah,
these
I asked,
questions?